Linda Patterson, and welcome to Community Pulse. The need is critical, very critical. Every 5 minutes, someone is diagnosed with a blood cancer disease. Every 9 minutes, someone dies. It's very unfortunate that this happens. We're talking about blood cancers, and we are talking here today with the wonderful Chief of Oncology at Kaiser Permanente, Dr. Sohail Saeed. Thank you so much for taking the time from your busy schedule. And I know after this you're running to see another patient. So thank you so much for being here. We are very happy.
Thank you for inviting.
I would like, Doctor, for you to tell our viewers at home, what exactly is a blood cancer and what is it called?
Excellent question. Blood cancer generally originates from the bone marrow. We have bone marrow that is a sort of factory production house from where all the blood is produced. This bone marrow is in the hip bones and in the chest bones mainly. From there, some abnormality occurs and abnormal cells start arising and they come in the blood. And of course, that abnormality sort of floods the blood. Now we have lymph nodes as well in our body. I'm pretty sure that mothers especially have noted that when children they get sick, so their neck glands swell. These are the lymph nodes. And I call them as police stations in the county of San Bernardino, that they are scattered all over our body. Bone marrow works very closely with these lymph nodes. And if any abnormality that arises in the bone marrow, like leukemia, affects the lymph nodes, and as a result the lymph nodes as well swell. So lymph nodes and bone marrow, they go hand to hand together. That is why lymphoma and leukemia is called as go hand to hand together. Now there is a third entity called as multiple myeloma that arises from the bone marrow. It is a cancer of the bone marrow, but there is a special cell in the bone marrow called as plasma cells, and cancer or tumor of that plasma cell is called as multiple myeloma.
I see, I see. So there's leukemia, lymphoma, and myeloma.
And myeloma.
And myeloma. So it's kind of divided into three.
Exactly. For the general population and public, it is easy to divide into three categories for their better understanding.
Okay. So what are some of the symptoms that one might have, doctor?
First of all, that there are no really specific symptoms one can say that points out exactly towards a particular disease. However, there are some general and common symptoms that are shared by all these diseases, like unusual fatigue, excessive fatigue, pallor of the face, easy bruising without any trauma or without hurting yourself anywhere. Beside that, unusual bleeding, all of a sudden nosebleed, gum bleeds, which were not existing before. These are the main general symptoms that one should be cautioned and then should obviously refer to the doctor.
I see. I see. That is rather interesting. Now, one of my neighbors told me that they had a lump on their right side, and they did a biopsy, and it turned out to be
A lymphoma.
A lymphoma.
Right.
And so it can show up like a lump as well.
Exactly. So that is what the lymph nodes are. And since they are scattered all over our body, under the armpits, on the sides of the body like groin, in the neck, above the collarbone. So whenever there is an unusual swelling in these areas, that should alert someone. That can occur even without any weight loss, without any other symptom. It can be an isolated symptom, and that should prompt the patient to go to the doctors right away.
Absolutely, absolutely. So once the person receives the diagnosis, is there treatment?
Absolutely. We have excellent treatments. We have evolved a lot in this area of lymphoma, leukemia, and multiple myeloma. And especially I can speak about Kaiser Fontana. Our area medical director, Dr. David Kwam, has taken a special interest in oncology and hematology,
Mm-hmm.
and has encouraged all of us and to make it a sort of center of excellence.
Mm-hmm.
And our chief of medicine, Dr. Gabriel Selassie, as well, is very, very much supportive. So when the patient arrives, we have a detailed discussion with the patient, and we give them various treatment options, and majority of them can achieve complete cure.
Absolutely. So, what types of treatments are there? It
Usually,
depends also, right?
It's exactly, but usually these treatments are with chemotherapy. And of course, as soon as patients hear the name chemotherapy, they get very alarmed and they get very much
Right.
cautious. I try to comfort them by telling that, look, chemotherapy simply means therapy with a chemical. If you have headache,
Mm-hmm.
you take a Tylenol, you are giving a therapy with a chemical to yourself.
Mm-hmm.
The side effects of every chemical is different.
Right.
And we have excellent medications to control these side effects, to support the patient and walk through this difficult process along with the patient and the family.
Okay, so there can be life in spite of it.
Absolutely.
And many patients go into remission as well.
Exactly. That's what happens.
Very good, very good. Now, can a blood cancer disorder affect a young person as well?
Blood cancer disorders or disorders of the lymph gland or
Okay.
the multiple myeloma, of course, can affect generally all ages, but there are certain cancers that are common in young age,
Mm-hmm.
then there are certain cancers that are common in old age, like multiple myeloma is very common in the old age.
Mm-hmm.
Old age we generally defined 65 and above.
I see, I see. So I heard of again, another story I heard of a 7-year-old that had a leukemia and is taking treatment. Now, is the treatment weeks, months, usually?
Excellent question. It depends on the type of leukemia the patient has. Generally, the treatment for childhood leukemia is
Mhm.
different from the treatment of adult onset leukemia.
Mhm.
And usually the treatment lasts for a couple of months,
Mhm.
and we expect and achieve 90% or above complete remission and cure rates.
Very good, very good. Now, I understand that you work with the Leukemia Society.
That's correct.
Okay, could you tell us a little bit about that?
Lymphoma Leukemia Society has provided us tremendous help, and they have been really instrumental in providing us literature as well, which we can give to our patients, and not only that, rather providing support
Mm-hmm.
to the patient and their families to go through this difficult process.
I see. So they help not only with educational materials, but they're also available for some financial assistance
They
as
are
well.
available 24/7, and they are
24/7.
of extreme help to us.
Right. So what they do is when you call in, they usually match you with another person in a similar circumstance.
Now, if you are referring to the bone marrow transplant
Right.
or a stem cell transplant, yes, Leukemia Lymphoma Society as well helps a lot with that matching program,
Okay.
and they work very closely with us to help the patient and their families.
Now, I understand you've gone a step further by putting together a program at Fontana Medical Center. Could you tell me about that?
Thank you for asking that. Yes, we have developed a support group for lymphoma, leukemia, multiple myeloma, and we meet the first Tuesday of every month from 5 o'clock to 6:30 p.m.
Mm-hmm.
Lymphoma Leukemia Society have been very generous and kind to provide not only educational material, but as well some snacks and drinks for the patient and the family. This brings not only patient together, but as well develops a bond between the doctors and the patients. Patients can ask several questions. I'm very sorry about
That's
that.
okay. You're a doctor. You're supposed
Thank
to
you
be
very
beat.
much. Patients can ask several questions. They can interact closely with the doctors. Their families can ask many questions. And in a relaxed environment, they ask so many different questions that they don't get to ask when they're in the doctor's office.
Right.
So that helps a lot.
That
And
really does.
I will urge and request patient and their families, not only Kaiser members, but as well Kaiser non-members, to come and join us every first Tuesday of the month from 5 o'clock to 6 or 6:30.
Very good. Now, if they want more information, I have a phone number they can call, 909-754-8392. Write it down. If you have more need for information about that support group Dr. Saeed works with, 909-754-8392. Please call and they'll give you more information at that number, right?
Absolutely, we will be looking forward.
Very good. Dr. Saeed, it's been a pleasure. Our time is up, believe it or not.
Well, the
12
time
minutes
flies.
goes like that.
Exactly.
And you've done an amazing job.
Thank you so very much.
Thank you so
Appreciate
very
it.
much for being here today.
Right.
And
Thank you for the
be careful
invitation.
going to the clinic to see that other patient you've got to see.
Thank you.
And there is hope.
There is always hope. And that's what our job is as physicians, not only to provide hope to the patient, but to their families and to help them going through this difficult process.
Very good. Very good. Thank you.
Thank you. very
Well,
much.
see, that was a very good program, Community Pulse. We're going to take a quick break and then we'll be right back. Thank you.
Electricity is a part of our daily life. At play and at work, we rely on electricity in nearly everything we do. And safety around electricity is essential. A downed power line could be extremely dangerous, so if you see one, stay clear of it and call 911. And stay away from power facilities, because contact with electric lines and equipment can cause serious injury or death. It's always best to be safe. Brought to you by Southern California Edison and Edison International Company.
Welcome back. I told you we had exciting guests earlier, but now we have a new set of guests for you that's just as exciting and very interesting as well. And it's just for you. I'm Erlinda Patterson and this is Community Pulse. Today we are talking about stroke in women. And we have with us Dr. Michael B. Lee, who is the stroke director in Ontario.
Pleasure to be here.
Fontana Medical Center, correct? Also,
Correct.
is that? And Ontario.
Ontario mainly.
Right, okay. Very good. And we have with us Martha Lopez, RN Clinical Director. I'd reach over there and shake your hand, but just pretend. Thank you for joining us again.
Thank you
It's really
for
wonderful to
having us.
have you.
Thank you.
And we have the wonderful Kathy Watrous, RN, MSN Stroke Coordinator. Thank you.
Thank you
It's
for
good
having
to have
us.
you. It's good to have you. You know, this subject is very near and dear to a lot of people's hearts. Stroke in women. You know, doctor, why don't you tell us a little bit about this?
So I think the biggest thing is that you don't normally think of stroke as being a woman's disease, but in many ways it is. Actually, twice as many women die from stroke as from breast cancer.
Is that right?
And yet breast cancer has a lot more awareness, there's a ribbon, there's a lot more public attention. And stroke, for whatever reason, doesn't have the same amount of publicity. But it's actually the #1 cause of disability in the United States. And all of us have had direct family experience with stroke. It's not just something that we talk about as medical professionals. But
Right.
my grandmother had a devastating stroke. So
Is that right?
our hope is that the information that we're going to present today can prevent you or a loved one from suffering a stroke. So stroke is a huge problem in women. And in fact, women age 45 to 54 are 3 times as likely to have a stroke than a man of the same age.
Is that right?
And the main reason that's the case is actually the incredible increase in obesity and increased abdominal fat. So what that does is it increases your risk for high blood pressure, increases risk for diabetes. All of these are risk factors for stroke, as well as high cholesterol. And it's not as sexy to think about controlling weight and exercise, but these are things that you can do on a daily basis that will decrease your stroke risk.
I see. Now, where you work in your clinic, do you see a lot of obesity in the women that you work with?
Yes,
You
mainly
do.
in the Hispanic women.
Mainly in the Hispanic women. in that particular population. Would you attribute it to the types of foods that they're eating, or?
Yeah, I think it's a cultural thing. So I think it's how they've been brought up and what they're eating.
I see. So Kathy, what is your experience as a coordinator with the stroke issue?
Well, as Dr. Lee says, we are seeing an increase, and it's very alarming. So we are seeing it with certain a certain population, like a lot of people with or experiencing a stroke do have diabetes. We do see it with people that have hypertension, have high blood pressure, and we see it with the high cholesterol, especially the LDL. And so, you know, we know that knowledge is power, and we want to impart the knowledge that we know to the community so that we can prevent. You know, if we can, you know, just tell you go get out a little bit more and exercise, or, you know, instead of having the Big Mac somewhere, have the salad, you know, then we seriously need to do it, because as Dr. Lee said, we're seeing it in younger people, much younger, and it's not an old person's disease. It's going younger and younger, and that is frightening to us. And you can even sometimes see it, you know, in people in the 20s. Which
in their
is,
20s.
It's very frightening. So that's why it was important for us to get out and communicate what we know and tell people, because a lot of people don't know it's so high in the female population, and that is frightening, you know, especially being a female.
Right. And what is FAST? I've heard the word FAST.
Well, FAST is what we want to tell people they need to do if they see a stroke. So we say act fast, because if you see like the facial drooping, then that's usually a sign. Or if you see in people that they can't have their arms level, and that one's drooping more, so that would be the face would be the F, the S is the, or the arms is the A. S is, do they have slurred speech? You know, if someone suddenly has slurred speech, or they can't communicate that well. And then the T stands for time. Time is of the essence. The faster you get to an emergency facility, the faster you get treatment. And, you know, immediate treatment for this, you can save a lot of disability, lifelong disability.
I see that. I see. Now, smoking, does that attribute, or is that a problem?
Sure, smoking causes a lot of health problems, and it doubles your risk of stroke as well. So a lot of these things are people are aware of, that high blood pressure is not a good thing, that being overweight is not a good thing, diabetes is not a good thing. But to think more concretely that 80% of strokes can be prevented if you just control these basic risk factors that we mentioned. That's huge. You know, if you can, it's much better to avoid a problem than to try and recover afterwards, because the truth is the brain doesn't recover to the same degree that the rest of the body does. And I think that would be my main message, is that most of the benefit is reducing the risk factors for stroke. The second thing, though, is stroke is an emergency. There are several treatments that you can only receive in the first 3 hours of having these symptoms. So if people wait, they think, oh, maybe I'll get better, or maybe this is something else, then they can lose out on a treatment that could potentially be life-saving.
I understand. Now, time in the brain is early intervention, right? Working with the brain, you need to immediately work with it if there's a problem, right?
That's right.
Don't hesitate. So a lot of people that have one of the symptoms might say, oh, I'll go tomorrow.
And many do, Erlinda. Many wake up in the middle of the night at like 2 a.m. and they say, wow, my face is numb, or, you know, it's hard to move my left leg or my left arm, but I'll go in the morning. No, you need to go right away, because time is of the essence, like Dr. Lee said.
Right.
Within the first 3 hours you can get treatment. So a lot of people we are seeing, unfortunately, waiting through the night and coming in hours after, like 6, 7, 8 hours later. Or women going to work and then, you know, coming after work, or when, you know, they go and go to work and their friends say, no, you need to go get seen. And then we're out of that time. We're out of that time.
Right, right. So tell me, having a stroke, and is there a recuperation time? Does it take 3 months, 6 months, a year to rehabilitate an individual back to, will they ever be back to where they were?
So one of the new things that we've learned over the last several years is that stroke recovery is a continual process. We used to think that most of the benefit would end after the first 6 months of the first year, but it turns out that people can continue to recover even after that. And they do that with physical therapy. You have to retrain the body, retrain the mind to pick up whatever it was that was lost.
Okay. Because some people have to be trained how to eat all over again and even walk because they lose that power, that control that they had before.
And speaking.
And speaking, even just speaking.
And to swallow, things like that. So yeah, if we can prevent it, that's the goal, is to prevent it by, you know, as I said, to impart knowledge, because knowledge is power. And we're at the time where we do need to make changes in our lifestyle. You know, we know about it with heart disease and other things, but you know, it is true in your life. You need to eat healthy and get a healthier diet, and we all need to exercise. We can't be sedentary and sitting at computers or desks. We need to walk a couple times a week, or do some form of exercise, whatever is someone's forte, whether it's swimming, walking, just something to get outside and get your body moving.
Is this, doctor, is this genetic?
There are some genetic causes of stroke, but they're very rare.
Oh, I see.
So, as we said, 80% of it are things that you can change.
Okay.
Now, you can't change your age.
Right.
You can't, there's no time machine.
Right.
But everyone can exercise at least 30 minutes several times a week. We can all watch our diet, try to avoid too much fast food or high-fat, high-salt diet.
Right.
If we have diabetes, we can control that by taking medicines and exercise. So really, the battle is one moment at a time, one meal at a time, one high blood pressure pill at a time. It's not something that's dramatic.
Be compliant with your medication.
That's right. That's
Very
right.
important. Now, our time is up. In closing, Kathy, do you have a comment you'd like to leave with the viewer with?
You know, as a woman, Erlinda, so many women, we take on so much responsibility.
Right.
And as a mom or a daughter and a sister, and you know, women put themselves last, but we need to put ourselves first. You know, we need to take care of ourselves. We need to say it's okay to lay down and not have a spotless house.
Right.
You know, we need to relax too, and you know, take care of ourselves. Do the right things, and then we can take care of other people. But you know, it's so much is happening to women, and I think we just always tend to put ourselves last. So it's okay to put yourself first and to
So
take care
that
of
you
yourself.
can take all those
Absolutely.
around you to take care of
Absolutely.
them. Yeah. Right. How about yourself, Martha?
Well, it's the awareness and not to ignore symptoms. For women, as like Kathy said, I think we kind of leave ourselves for last, but not to ignore, because if not, we won't be able to provide for our loved ones.
Okay. Very good. Very good. And doctor, please.
So stroke is a sudden loss of function of something that you can normally do.
Okay.
So if all of a sudden you can't raise one arm,
Right.
all of a sudden you can't speak, all of a sudden you have weakness of one side, that could be a stroke.
Right.
It's an emergency. You need to dial 911 and be evaluated, because there are treatments that can only be given in the first 3 hours. Stroke is mostly preventable, and you do it by living healthy. It's the things that we all know that we should do, but don't do enough.
Right. Very important comment. Thank you. Thank you for adding that. Doctor, you've been great. Thank you very much for being here, Dr. Lee.
Pleasure.
Thank you, Martha.
Thank you.
You're doing a great job out there. Keep it up. And Kathy, for your advocacy in women's health and in stroke. Please, thank you.
Thank you. Thank you for
very
having
much.
us.
Yes, thank you.
Yes, it was a pleasure. And hopefully the viewers today have learned something and will be a little more careful. Thank you. Well, this has been Community Pulse. I'm Erlinda Patterson. I told you the subject was going to be very near and dear to you. So please, until next time, take care. And take care.